the human back. Immediately beneath the skin lies a massive, continuous sheet of muscle, dominating the entire upper topography of the torso. This is the trapezius. It is the largest superficial extrinsic muscle of the entire back. On a single side, it forms a wide triangle, but when you examine both sides together, they form the four-sided geometric shape that gives the muscle its name, a trapezium. Anatomical literature defines its core utility by what it bridges. It creates a direct connection between the skull and the vertebral column at the center of the body out to the clavicle and scapula of the shoulder girdle. That massive surface area is required to act as a primary structural matrix, anchoring the highly mobile appendicular arms to the rigidly stable central axis of the spine. The shoulder joint faces a severe mechanical problem. It requires immense mobility, which in turn demands extreme dynamic stabilization to manage heavy loads. To see how the body solves this, we need to clear the canvas and strip away the muscular layers down to the bare axial and appendicular skeleton. Instead of memorizing a list of physiological actions, we can rebuild the trapezius from its foundational anchor points to see exactly how it works. In anatomical biomechanics, precise spatial geometry dictates function. Where a muscle attaches determines exactly how it can pull. By mapping the exact origin and insertion vectors of the trapezius, its complex array of movements, from shrugging to heavy stabilization, becomes a highly predictable emergent property of its geometry. Starting at the origin points, this map traces the trapezius against the midline. The highest anchor locks onto the skull's external occipital protuberance. It moves inferiorly to the ligamentum nuchae and C7 vertebra, then straight down, securing to all 12 thoracic vertebrae. That creates an unbroken, continuous attachment line spanning from the base of the skull completely through to the lower back. Mechanically, this establishes a massive, unyielding base. The central axial skeleton does not move when the arm pulls, giving a fixed, rigid point of leverage. Without this vast medial axis, the trapezius could not generate the high-torque rotational forces required to manipulate the heavy shoulder girdle suspended laterally alongside it. Now we track from that fixed medial anchor out to the highly mobile lateral insertion points on the shoulder itself. Fibers radiate from the midline, converging into a tight V-shape over the shoulder. Superior fibers reach the front, anchoring to the lateral clavicle. Middle fibers drive across to the acromion process. Inferior fibers angle upward, inserting along the spine of the scapula. This continuous U-shaped insertion wraps around the top of the shoulder joint. This geometry turns the trapezius into a master clamp, pinning the scapula securely. Because of the steep angle from the skull down to the collarbone, isolating the upper fibers limits their mechanical capability to a single action, elevation. The trapezius operates as multiple distinct functional units. Its varied insertion geometry allows for completely isolated lines of pull, executing entirely different mechanical actions depending on which region of the muscle fires. This presents a severe processing problem for the central nervous system. How do you coordinate accurate commands for a continuous muscle possessing divergent force vectors? The anatomical literature points to a unique solution. The trapezius possesses a highly specific dual-component nerve supply. The primary motor pathway is cranial nerve 11. It's rare for a back muscle to be innervated by a cranial nerve from the brain, reflecting a distinct origin. But this requires a sensory pathway to return data, fed by C3 and C4 spinal nerves. This is proprioceptive feedback. It provides the brain with a vital, continuous data stream regarding the precise tension and spatial position of the muscle fibers in real time. Flawless scapular stabilization requires this closed-loop system, continuous, high-fidelity tension data instantly guiding the powerful motor output of cranial nerve 11. We can observe exactly why this precise geometry and neural control matter during the ultimate test of shoulder mechanics, raising the arm straight overhead. A mechanical paradox occurs here. The humerus cannot physically achieve 180 degrees of elevation on its own. The shoulder blade must actively rotate upward to clear the joint space. The trapezius initiates this by functioning like hands on a steering wheel. The upper fibers pull up on the clavicle and acromion, while the lower fibers simultaneously pull down on the scapular spine, forcing the entire bone to rotate. This visual mechanism illustrates exactly what textbook functional parameters describe when noting the trapezius assists in the rotation of the scapula for overhead abduction. Without the precise geometry of the trapezius initiating this rotation, severe bony impingement would occur, making overhead clearance physically impossible. The massive spread of the origin points and the closed-loop neural circuitry exists strictly to master this paradox, providing unyielding stability while actively driving complex skeletal rotation. Having mapped the active biomechanics, we are left with a final topographical question. What structures lie immediately beneath this massive superficial shield? If we render the trapezius transparent, we reveal a dense, intricately layered system of deep musculature covering the rib cage and spine. Anatomical definitions detail these specific relations, mapping the underlying layer to include the levator scapulae, the rhomboid muscles, and the splenius capitis. The trapezius acts as the master superficial capstone over all of these deep structures, locking the entire thoracic assembly together. The trapezius is heavily utilized, yet rarely understood in full. Its vast geometric origin, unique cranial nerve control, and tightly converging lines of pull make it an indispensable architectural bridge, dictating both the extreme mobility of the upper lens and the structural integrity of the entire back.